I'm Dr. Amyn Rajani. I'm a specialist in arthroscopy and joint replacement, and I practice at Beach Candy Hospital, Leelavati Hospital, and Saifi Hospital, Mumbai. So, as you're aware, more than 2.5 lakh people undergo a total knee replacement surgery every year in India, and the number is going to increase annually. So, as you all know, total knee replacement surgery is a very common surgery nowadays. Most of the people are aware what total knee replacement surgery is. But is that the only option for a patient undergoing knee pain? I don't think so. There's another option which is not so well known, is a partial knee replacement. In this particular surgery, we are changing only the damaged 30% of the knee surface and keeping the remaining 70% natural and God-given. Now we all know what is God-given and natural is going to be much better than artificial. And when we can get away without doing a total knee replacement surgery, it is a much better option for the patient. With a newer design of the partial mobile bearing knee, it has become much easier to do this surgery for surgeons after a good training, and it gives a lot of gratification to the patient as well as to the surgeon after doing this surgery. So I'm not saying that total knee replacement surgery is going to be an obsolete surgery. It is going to be a surgery in the future as well for those patients who require it. But a unicompartmental or a partial knee replacement surgery is the future, with more and more number of surgeons getting trained to do this surgery and more patients getting aware about this option. I think partial knee replacement is the future and it's here to stay. So if you compare a total knee replacement to a partial knee replacement, in a total knee replacement, we are removing all the ligaments around the knee, the ACL, the PCL. We also do a release of the medial collateral ligament. But in a unicompartmental knee, we do not touch the ligaments at all. We do not release the MCL, which is the medial collateral ligament. We do not touch the ACL or the PCL. So the knee remains more natural and more normal compared to a total knee replacement surgery. After completing my orthopedic training, I went on to go ahead and do fellowships in joint replacement and arthroscopy at premier centers around the world, followed by which I started my own practice in 2008. When I started doing a lot of total joint replacements, total knee replacements, when I realized that a lot of patients that I'm doing knee surgeries for have disease only in one compartment, and I'm changing the normal natural compartment of that patient by giving them an artificial joint. In 2014, we operated on a patient who was 98 years old, and we again faced the same issue that the lateral side or the outer side and the front side, that is 70% of the knee, was absolutely normal. And I felt it was criminal of me to go ahead and replace that natural God-given knee. That is when I decided to go ahead and train myself in mobile bearing unicompartmental knee replacements. I went to Korea to train with a surgeon for unicompartmental knee in 2015. I spent about a month training for unicompartmental knee with this surgeon from a premier institute in Seoul, followed by which I went ahead to Oxford Group and trained with the designer surgeon, Dr. Christopher Dodd, who has designed the third generation implant of unicompartmental knee. I came back to India and started doing these surgeries, first with a few patients of mine whom I felt was the correct surgery to do. Now I'm doing about 75% of my patients are unicompartmental knee replacement surgeries, and the remaining 25 are total knee. Because as I mentioned earlier, even according to literature, only 25% patients require a total knee replacement. There are a lot of challenges as far as mobile bearing partial knee replacement is concerned. First and foremost, you have to be certified to go ahead and do an Oxford mobile bearing partial knee replacement. This certification is obtained by doing a instructional course which happens once a year around the world. Luckily for us in India, it has been happening once every 2 or 3 years in our country. Unless and until you are certified by this particular instructional course, you are not allowed to use this partial knee replacement. That is the first and foremost challenge. The second technical challenge is that it is done through a very small incision, and the entire concept of total knee replacement is reversed in this particular surgery. So somebody who's been doing a total knee replacement for many years for him doing a partial knee replacement is completely forgetting the concepts of total knee replacement. The third and the most important challenge is that there is a scare amongst the surgeons. With a mobile bearing partial knee replacement, there are chances of dislocations which can happen. But this only happens when you're not trained, when you're doing far few numbers, because the more numbers you do, the more surgeries that you do for partial knee replacement, the lesser the chances of complications. So if you have to decide to get a partial knee replacement done from a particular surgeon, it is very imperative to know what are the numbers of surgeries he's doing for his patients annually as far as partial knee replacement is concerned. So partial knee replacement was started in the late 1970s, and there were two types of partial knees which were available, was the fixed bearing partial knees and the mobile bearing partial knees. The fixed bearing partial knees, the results were not so great because of early wear, but the mobile bearing partial knees were taken up very nicely by this group from Oxford, which is called the Oxford group, which designed the mobile bearing partial knee replacement, which is the one and only mobile bearing partial knee replacement available in the world. All around the world, especially the UK and the US, and now very much in India, there are a lot of surgeons who are doing partial knee replacements, but there are also a lot of surgeons who avoid this surgery for various reasons which we will discuss further.